Hey guys, this is Coach Bill with Weight Loss Made Easy Solution. Hope everybody's having a great Thursday. We're heating up again, so we're supposed to hit double digits here in the Temecula Valley and Marietta Valley area. So with all the gyms having to put all their equipment outside in the heat, and we are going to have to get up a little earlier, which is okay for me because I normally get up early anyway. Emily likes her beauty sleep. That's why she looks so beautiful, it's because she sleeps in. So it must work. So guys, today I just wanted to get on here today, and I'm going to rant a little bit, maybe a lot of bit, because I'm really getting tired of these naysayers out there who are attacking not only me, which for me personally I don't care, because all they're doing is making fools of themselves and just showing how ignorant they really are. But what's happening now, guys, is these naysayers or these people that are voicing their opinion about a certain subject, they have no experience in the health industry. They have no idea even how to research, and all they're doing is spouting off, making idiots out of themselves. And what they're doing out there, and this is why I'm on here, is these naysayers are attacking some of the top health trainers and health professionals and nutritionists that and doctors even, that are on YouTube that do have science that are backing up what they're saying, and that are just trying to put honest information on social media to reach out to the people, because the public isn't getting the right information. They're getting wrong information from people that have no idea what they're saying. They have no idea. They have never really, their occupation is not in the health industry. Most all of them didn't even raise their family in the health industry. All they're doing is just putting on what they're calling today fake news. They have no idea how to research. They have no idea what research really looks like or how to define it. And so by them attacking some of these like I say, there's some doctors out there, and there's some nutritionists out there, there's some health coaches out there, like Thomas DeLar, or the guy that they call, Fledge, and Dr. Boz, and Dr. There's just a whole bunch of them out there that are really doing a great job, and they're promoting their way of life. Now, a lot of the big thing nowadays is primary eating or a ketogenic diet, combining with intermittent fasting. There's tons and tons of science out there showing not only the weight loss benefits or the body fat benefits, but most importantly, how it affects overall health and the benefits of that. And these doctors and these health coaches and these nutritionists are helping hundreds and hundreds of people, some of them even thousands of people, because they've been doing it for decades. A couple of these fitness coaches out there have been doing this for decades, and they have their own research, and they've helped thousands of people. And then you're going to get these naysayers, or these people that have no education at all, who never really know anything about the physiology of the body, saying that they're wrong and the science that they're submitting is wrong. I mean, that's ludicrous. You're just making fools out of yourselves. You guys that are doing this, you need to stop. And if you really know how to research real science, you can see what they're saying is absolutely true. Okay? So, instead of attacking people like us and doctors that are promoting a healthy lifestyle, who actually have clients and patients, and they've documented the progress and the improvements, then how does it make sense for you to criticize what they're doing is wrong? When you don't even make a living at doing what we are doing. This is how I make my living. You know, I mean, these people, these health professionals and doctors, they got decades of experience, actual in-house experience under their belts. And that brings up another topic. I'm getting sick and tired of a naysayer going after us, not just me, but the rest of us, and asking questions like, well, how many certificates do you have? Or what college did you go to? Or are you a PhD? I mean, that's BS, guys, because the best coaches out there and the best fitness coaches out there are the ones that have decades of experience, life experience, working with patients or clients under their belts, and their testimonials show it. Those are the best ones out there. Somebody who graduates from college with a PhD or whatever, or a BA in health and science, they don't have the experience like we have. Emily and I have been in the health industry for over 40 years. We've been in all aspects of health. We work as a partner as far as working with some physical therapy companies when we owned our gym. We worked with athletes. We worked with people that have had heart attacks. We worked with people that had shoulder surgery or knee surgery, rehab them. I actually worked with multiple workman comp insurance companies to rehab their clients over the years. And so, but I don't have a big old PhD, a PhD under my belt. I don't have all these fancy certificates under my belt. But what I do have is I have decades of on-site experience under my belt, as well as my wife does. Not only are all of us experienced over the years on actually working on people, is that we also do continual education and we're open-minded. That's the problem. A lot of these health professionals out there aren't open-minded and they don't do continual education. So guys, those you out there that think you know everything or think you know about health or is criticizing one of the top fitness coaches out there, there's quite a few on YouTube. You can pick those good ones out. Instead of attacking them, attack the ones that do have the PhDs or do have the medical certificate or do go through college and become a doctor. And the reason why I'm saying to attack them, because look it. If you know how to do your research and you're criticizing somebody who has on-site experience and has been doing it for has to be over 10 years. Most of those out there that are actually on YouTube promoting whatever program they hire, they have 20, 30, 40 years, if not more. But you guys need to look at our medical industry. Instead of attacking us, attack them. Because this is what your so-called Google, which most of you that have no experience and are trying to debunk some of these top trainers out there, you guys don't know how to do your research. But this is what research is saying. Okay? I'm going to read it. And then if you go to my YouTube channel, type in Bill Mabry, subscribe to it, this video will be in there. And if you go to the description section of the video, click on the description, and I'm going to post what I'm about to say today. That way, I'm doing you a favor and showing you how to research. But this is what they're saying. So according to the statistics, like I said, you need to go after the doctors out there because this is what they're saying. So according to the statistics, 1 in every 100 Americans will die this year by a drug-related or medical procedure cause. Didn't say personal fitness coach or personal coach. It says doctors. Okay? Modern medicine stated the third leading cause of death in the U.S. most doctors do not want you to know about. Guys, did you just hear what I said? Now, don't get me wrong. You guys, we have some of the best emergency doctors in the world. We have some of the best surgery doctors in the world. These doctors are specifically trained for doing certain things, and they are really good at it. But there's only a few of them like that. Most of the other doctors out there have closed-minded. They're being governed under the MAA, which is the American Medical Association. They're being watched very closely because if they go against their rules when they're trying to treat a patient, they will get their license pulled and fined. Now, I know some really good doctors out there, and some of you most likely do too, who are actually are looking back, seeing what they've done. One of the top kidney doctors in the nation, or actually I know of, who actually is the grandfather or the father of reversing type 2 diabetes and obesity and fatty livers, he stated as on his seminars. He was taught, and he actually did for 20 years, was treating his type 2 diabetes, his obesity patients wrong for 20 years. Now he's an advocate of reversing prediabetes, type 2 diabetes, and obesity naturally, just by changing the type of foods they're eating, combining it with intermittent fasting. His name is Dr. Jason Fung. You can go look it up yourself. He's an advocate. He's teaching other doctors, and there's many, many more doctors going to this procedure to reverse many medical issues. That's including cancer. Okay? But they have to do it under the radar here in the United States. I'm working with some doctors right now personally that are advocates of natural ways of curing or helping to cure many disease models naturally. But they have to do it under the radar. Okay? Now, let's see what else they say about the third highest death in the United States done by doctor mistakes, hospital mistakes. Now, think about this. All of our up-and-coming doctors, our new doctors that are actually going through college now, those colleges are ran by who? If you know how to research, you will know for a fact that these universities are ran by the pharmaceutical and the AMA. So these doctors are not getting trained to treat the root cause of their clients. And so what's happening is they're being trained on how to use medication and drugs that is known by science, I'm talking real science, that doesn't work. All it is a Band-Aid. It does not cure the root cause. Your body is the cure to root cause. But you have to give it the right tools to get that immune system to be at this highest levels because of how bad the environment is, toxic chemicals in the environment, how bad all the chemicals are in food, and especially how bad the chemicals are in the water you're drinking. And so you have to have the right tools, and the up-and-coming doctors are not being taught this. That's why doctors' mistakes or doctors' issues is the third highest death in the United States. It's not me saying this, guys. I'm just reading you what the CDC is going to say. All right, here we go. Google. Okay, so I Googled this. What is the top deaths here in the United States? Okay, I Googled it, like those naysayers do. They don't go into an actual research site to get their research. They just say Google. And we all know Google doesn't tell the truth. It's not governed. There's nobody watching it at all. But this is what Google said. It says, according to a recent study by Johns Hopkins, more than 250,000 people in the United States die every year because of medical mistakes, making it the third leading cause of death after heart disease and cancer. Now, this was published in 2018. So, my opinion is going to, actually 250,000 isn't even enough because a lot of them they're not going to even post. Here's another site or research site that says studies suggest that medical errors now the third leading cause of death in the U.S. Now, I put this link. This is by Johns Hopkins University, and it's more specific on the information, on how they got it. And I put that in the post so you can see it yourself. Look up CDC and see what they say about the third largest deaths in the United States. Doctors' errors, hospital errors, medication errors, overdoses are all on that list. Another big issue is staff and MRSA that are in the hospitals because of unsanitary utensils, that we all know that when you go to the hospital, most likely somebody's going to get staph or actually MRSA, which is a flesh-eating disease. Now, that's another experience that we have under our belts. We have worked with people that had flesh-eating diseases that got it from the hospital while they were there for surgery. Not only in adults, but in kids. Okay? We had somebody 3 years ago at the child's, the San Diego Hospital for Kids or whatever. We had to go down and take some of our hypochlorous acid that our medical device, the machine that we have that makes our hydrogen-rich water, also makes the powerfulest antibacterial water on the planet. And we had to take some down to the San Diego Children's Hospital because this person caught a very rare staph or flesh-eating disease in the ear. And they couldn't stop it. The antibiotics couldn't stop it. They tried multiple antibiotics and they weren't working, and they were getting a little worried. Now, when the family called us for help, did I know if the hypochlorous acid, which is known by science to be the most powerful antibacterial on the planet, is going to work? No, I didn't know it was good. Have I seen it work for this type of stuff? Yes. But I don't know if it's going to work for him. All we could do is try. Well, guess what, guys? She made a full recovery. But you know what the doctor said? Nurses said? Oh, the antibiotics are working. You see, that's what we call on-site experience. You can get a certification as a personal trainer. You can get a certification as a nutritionist. You can get a certification as a health coach. You can spend $100, $200, $300, $1,000 and get these certificates. It does not match anything. It does not match somebody who has decades of experience out there under their belt, who have actually worked in the field and has seen the results, and they document the results. Doesn't even compare to that. So don't even think that all these certificates and PhDs and going to college, the stuff that we're doing, that a lot of these fitness coaches are talking about on YouTube to help people reverse diseases, they didn't learn that from college. They had to go outside the box just like Emily and I did. We had to go to schools that were outside, or we had to go to classes that were outside of colleges to learn what we're learning, because the university can't teach this. Because it doesn't focus, because it doesn't match what's the word I'm trying to say, what the AMA or what the pharmaceutical companies want you to know. Why in the world would the pharmaceutical companies or the oncologists who prescribe the most poisonous chemical on the planet to put in somebody's body who is already sick, why would they want to know that there is other ways to reverse those root causes? You guys know the answer to that. I'm sure you do. Because of why? It's all about money. It's all about what's in their wallet. But guys, there is some good news. More and more doctors and more nutritionists, even Loma Linda, I've met a couple of them that told me they were never taught what we're teaching people now in the university. But when they got out of the university, they were strong enough, and they wanted to help their patients, so they went outside the box, and they're learning the natural way to reverse diseases. So there's some encouragement there. And like I said, guys, we have some of the best emergency doctors on this planet. We have some of the best medical surgeons on this planet. There's one known as Dr. Hermosa Shinya, who is one of the top cancer doctors in the world, who treated his patients naturally. And he's got documentations of reversing cancer and colon cancer and IBS and colitis and all those gut issues. He's one of the founders of the colonoscopy. But he's also a natural. He wrote books about it. See? So they're out there, but you just don't know about it. So guys, I just had to get on here. I'm sorry if I ranted too much, but you're attacking fellow coaches, you're attacking fellow nutritionists, you're attacking fellow fitness coaches out there, and you have no right at all to voice your opinion unless you have been experienced and are making a living at it and know how to research and have decades of research and experience under your belt. And before you make any kind of comment, you need to research first what you're about to say to that person, because all you're doing is making a fool out of yourself, showing your ignorance. That's all you're doing. Okay? There's a lot of us out there that are trying to help the public, trying to educate them the truth, and then back it up by science. Okay, guys? So that's my rant for the day. Hopefully, I got my blood pressure, I'm sure, is up pretty high right now. But I hope you guys understand what I'm trying to do here. I hope I didn't make a fool out of myself either. But anyway, you guys have a great day. We'll see you in the next video. Bye.